Hi, my name is Lexi Stevens. I will be performing my trach care today. First thing we're going to do is determine the need for care of our patient, the trach care, and then we're going to assess if they're having any pain, and we would want to give them pain meds if they are. And then we're going to gather all of our supplies. We're going to explain the procedure to the patient, make sure they have their pain meds, and if they're having any discomfort, just raise their hand and we'll stop the procedure. Okay, and then we're going to provide privacy, perform hand hygiene, and identify our clients with the two identifiers, name, date of birth, and check their band as well as the MAR. Okay, so now we're going to open our sterile tray and do this aseptically. Grab our sterile field and only touching the outer edges, place that on the table. This would be my inner cannula, but it would be in a box, and then the sterile box, and then I would open that sterilely and just dump it onto my sterile field. And now I'm going to take the sterile saline, lip it, and as well pour it into my box, okay? Great. So now I am going to put on my mask, but I'm gonna put it down so you can hear me, and then I'm going to put on some non-sterile gloves. Okay, so we're gonna be at the patient and we're going to take off any oxygen if they had any with my non-dominant hand. Put my other hand or my non-dominant hand on the faceplate. Carefully pull out the old inner cannula, throw it away, and then grab the old dressing, ball it up in the glove, and then take off the gloves and throw them away. If you got soiled, you would re-perform hand hygiene. If you didn't, it's fine. Okay, so now I'm going to open my sterile gloves without letting it tent. Okay. All right, and then we're going to either put that in or do the gauze first. I'm just gonna do the gauze first. This will be our new dressing. I'm just gonna set it right there because that's sterile. And then, this one, is this the what? Oh well. And then put in and moisten it in this saline. Okay. As well as my applicators, or cotton swabs, or swabs. All right, so now I'm going to grab the new cannula, carefully hold the faceplate, insert this, and make sure it clips in. If they had oxygen, I would reapply that. And now I will clean the faceplate with my gauze, just throw it away. Again, throw it away. And then I'll clean around the stoma using only one and going from the inner to the outer. Throw it away. Do the same on the bottom. Throw it away. And then I would use the dry one and just blot dry. Okay, throw it away. Okay, so at this time I would have two nurses with me. One would hold the faceplate and while the other changes the collar. My patient nurse is going to hold the faceplate while I change the collar. So I would just unhook one side, bring it around, unhook the other side, throw it away, and then I would grab my new one, hook it up, put it around the patient's neck, hook it up again, and I would make sure I could fit at least one finger underneath it. Okay, feeling good? Good. All right, so now I am going to not take off my glove. I'm sorry. So we're gonna pretend that didn't happen. We're gonna put on our new sterile gauze and then put that around there. Okay, great. Now we're done. We're going to take these off, throw it away, perform hand hygiene. We're going to reassess the patient for comfort, pain, respiratory status. We would have assessed the stoma while we were cleaning as well, and record everything that we've done. and